The clock is ticking right now and still no deal to avoid a strike at local nursing homes. The deadline is coming up this Friday, and without a deal, 3,000 workers at 33 nursing homes could go on strike. Our chief political reporter, Susan Raff, she is live at Autumn Lake Healthcare in Cromwell with the issues keeping everybody from a deal right now. Susan.
Mark, that's right. In fact, the deadline is approaching fast, 6 a.m. Friday morning, which would affect this nursing home here in Cromwell and 32 others in the state. Those workers plan to strike. They tell us that the issues are really about wages and benefits. They say they've risked their lives during this pandemic and they want to be treated fairly.
I have so many coworkers who wound up in the hospital. I have coworkers who brought this disease home and their family members died.
Dory Harrington is an LPN who got COVID, and what she saw during the pandemic was scary. At the beginning, nursing homes didn't have enough PPE, and workers had to wear trash bags. Gloria Plummer works at another nursing home.
When I heard that the resident who sneezed on me died, I wondered if I'm next.
These workers want a raise. They say $15 an hour is not enough. They feel $20 should be the minimum. 1199, the union that represents them, says 3,000 nursing home workers have a tough job and risk their lives during the pandemic.
This workforce collectively held the hands of our grandmothers and our grandfathers when we could not be there with them during the course of the pandemic, and saw 4,000 nursing home residents pass away.
17 nursing home workers died because of COVID. They want better wages and affordable health insurance, and say what Governor Lamont is offering falls short. But Governor Lamont's director of communications says this funding package represents unprecedented increases in wages for these workers. It's time for nursing home operators and labor to get into a room and hammer out a deal to prevent any potential disruption of care for the people they serve.
Yesterday seemed like they had hit a bad spot, but I'm optimistic. And I think as long as the parties keep talking today and tomorrow, I'm optimistic.
Now, late this afternoon, the Department of Public Health said they had approved contingency plans for 26 nursing homes. Again, the big picture, 33 facilities could go on strike, workers there. We are told, however, that 7 nursing homes, the deadline has now been extended to the 28th of this month, and that's simply for the fact that there are no contingency plans and they cannot have plans in place at this time to provide for people if those workers go on strike. So the bottom line really is nobody wants a strike. The question is, can they avoid one? We are live in Cromwell. Susan Raff, Channel 3 Eyewitness News.